Sir, can you comment on the health care compact here?
You bet. The healthcare compact is a politically ambitious effort to basically get the federal government out of our healthcare, bring it to the states and to the people. So it's a sweeping proposal. It does much more than block Obamacare and the insidious power grab that's wrapped up in that. It also block grants Medicare and Medicaid. So it does two huge things. It brings that authority back into the states where it should have remained. And it also solves a huge part of the federal deficit problem because the unfunded Medicare liabilities are about half of the federal government's unfunded liabilities.
When you talk about it going back into the power of the states, a great deal of the argument against this health care bill has been the interstate commerce clause. Can you talk about the constitutionality then of this proposal?
Well, the health care bill passed by Congress and the President is blatantly unconstitutional. Our approach is legally cautious and politically ambitious. So we use an interstate compact, which is actually a rather common method for the states to cooperate. There are over 200 active interstate compacts. They cover things like driver's licenses and juvenile crime and a lot of other things. So they're routinely used. They're protected in Article 1, Section 10 of the Constitution. And importantly, this is no end run around the Congress. Congress has to ratify this. So this is basically the states calling the question, confronting Congress and saying, you are making a mess of our healthcare system. Keep your regulations, send us our money.
This Affordable Health Care Act is the most partisan piece of legislation that has been passed in my lifetime, and potentially in the history of American government, without one conservative vote, without one Republican supporter. Can you comment on the nature of how this bill was passed?
The nature of how it's passed is really important because, as you imply, there was something historic about it, and it was this. That was the first major legislation passed in America over the majority opposition of an engaged electorate. Okay, so there have been bills passed that weren't popular that kind of weren't noticed, but the big things, including Social Security and Medicare at the beginning, had bipartisan support, and they were not opposed by a majority of the public. So what Congress did here is defy the people they're supposed to represent. That was an extremely important part of the whole political setup to where we are now. You remember the town halls and the overwhelming opposition. Polls showed consistent opposition. It was stunning in a way, and it was revealing of a deep problem, which is this Congress here in the city we're in is not representative. They are really out of touch. We have a deep problem, and we have to do a couple things about that. But one is we have to pull back power and authority closer to home where we can guard it.
You have a next generation, my generation, I'm 25, that's coming up that is looking at a lot of these stalwart programs and saying Social Security, Medicaid, this is not going to be available for us. How does your plan solve that?
Well, it's a great question, and you're going to be taxed without benefiting for Social Security and Medicare. I'm afraid that's the fate you have, and as long as you count on not getting any benefits from it, you're halfway there. But this pulls it back to the states, and you know, the states won't all do the same thing. But your position is horrendous because you're going to be taxed a whole bunch, and the federal government cannot meet the promises it has made. It can't meet them, so it won't. It won't. We're going to have either heavy inflation, we're going to have rationing that's built into Obamacare, or we're going to have a phase-out like Paul Ryan proposed. That's a responsible but a one-size-fits-all plan, or much more true to America's past, is to pull it back to the states. Congress never should have pushed the federal government into health care. Pull it back to the states. And how will it be worked out in your state? I don't know. This compact is only 5 pages long. It does not prescribe, but it says we trust the people to make the best of this. And I'm confident that you won't come out worse under your state government than you're headed for under Congress.
Do you have any tactical messaging plans to bring this to my generation and say, hey guys, you really have to consider this?
Yeah, I think the thing we're doing that might be most appealing is we're walking away from the usual right versus left fight. We are not prescribing, and we're asking who decides. Who decides about your health care? It's a governance question to us. So we don't want to pick sides in the usual fight up here. And in fact, to give you an example of how flexible we are on policy and on marketing in the states, we're active in Vermont. The Vermont legislature passed a single payer plan, and we're telling them that could operate under the health care compact. The Massachusetts plan that Governor Romney signed could operate under the health care compact. Doing something like that in one state does not have federal constitutional implications, and it also can't sink the whole country. So I personally don't want my state government to do a single payer plan, but the Massachusetts plan has 2/3 support in polling in Massachusetts. So who am I to say that they can't do that? So part of our approach is to really say, hey, we can govern ourselves, we can discuss and debate and decide. As long as we're doing it in the states, we can learn from each other, we can cross state lines without having to leave the country. And importantly, we separate this from the printing press and the huge federal government here, and we make it so it doesn't have national bankruptcy implications. So we can save the republic and also restore self-governance.
They say there's 50 laboratories for democracy in America, as all Federalists would say. We've been interviewing as a special a great deal of the doctors that are brand new into Congress, and you have seen the largest percentage of doctors actually in the history of America serving right now since 1792, the first Congress. You have 3% of the Congress is doctors, and a lot of that was swept in 2010. Do you think that this Affordable Health Care Act has simply made health care more divisive of an issue than it ever was?
Oh, absolutely. Absolutely. The centralizers, the authoritarians, want to dictate. There's so much dictation in this. It's a massively pernicious bill, not just because it messes with our health care. I mean, the worst thing is taking control of families' health care from home into bureaucrats in Washington. That's really vile. But underneath that, it wants to turn the doctors into bureaucrats, by the way, and the health care delivery people into bureaucrats. It wants to turn insurance agents, independent agents, into bureaucrats for the federal government, and it treats the state governments as administrative units of the federal government. The whole thing assumes a European-style huge bureaucracy with a ruling elite in Washington dictating to all of us. So this thing is offensive far beyond health care, and every aspect of governance and in healthcare, it's insulting, and we are sheep to the creators of this plan. And I think the doctors and nurses are more aware of it because they're going to be told what they can do and not do. Their judgment is taken out. It wants to turn us into automatons. Bureaucrats serving sheep, that's the model of the radical left here, and this is a radical left-wing bill.